be talking about the shipping and delivery section first, and this covers the POPS and the old PPROD standards, and some of those have been combined into PMD, which is medication distribution. So it's kind of a new focus area that just looks at the shipping and delivery. So those are all kind of combined in what we'll be talking about next here. So the main changes, they've defined a little bit more what they're looking for with the shipping and delivery and qualification testing. So the first thing that you'll need to do is define your temperature excursions for the medications that you're delivering. So you define your the ideal range that you'll keep it in between for the temperature, but then also how warm it can go and how cold and for how long. So those will be the excursions. You've already defined those for medications that are stored in the pharmacy. So this is a little bit new that you're actually defining it separately and specifically for medications that are in distribution. And so as part of defining your shipping procedures as well, you'll need to determine the appropriate temperature ranges, the appropriate packing products that you're using, and shipping duration. So you define, do you ship for 24 hours or 48 hours? And then based on those variables, you're going to be doing your qualification testing. So making sure that your boxes that you pack actually maintain the medications for that defined temperature range with the allowable excursions for the duration that you've established. So that's kind of the process that they're going for. And as a part of that, you can also determine which room temperature medications are going to be shipped under controlled room temperature. So that's a little bit of new verbiage under this module.
What is that about? Controlled room temperature?
Yeah, so you're going to be defining the ranges for any room temperature medications, any refrigerated medications, and any frozen medications. Those are the three main temperature profiles. And room temperature medications are a little unique because some of them might have very specific temperature stability where they really should be only at room temperature. And some of them may have more flexibility where you could ship them in a different temperature profile and they're still going to be stable. So you have just the freedom to kind of define how exactly you're going to be shipping your room temperature medications, but this should be based on clinical guidelines and manufacturer guidelines and USP guidance and things like that.
Got it.
So a little bit more detail on the qualification testing. So URAC has updated the verbiage from testing based on the geographic distribution and regions that you're shipping to now testing based on the temperature profile where medications are shipped. So this is related because if you're shipping to Alaska and to Florida, those are different geographic regions and they're also different temperature profiles, but also thinking about summer and winter, those are also two different temperature profiles. So you want to just consider where you're shipping and what are some of the different temperature profiles and make sure that you ship to all temperature profiles or a region or time of year that's going to be representative of the areas that you're shipping to.
Got it. That makes sense. I mean, just Alaska is not always Alaska, you know. It's not always the tundra up there.
Right, exactly.
Oh, got it.
So,
right.
Yep. And then one other change to this version that's kind of interesting is the change for the ongoing periodic distribution testing. So in the previous standard, you had to do the qualification testing twice a year. Normally that was to comp for summer and winter. Now they've already established that in the different temperatures that you're testing. But now what you need to do is do some sort of periodic testing. So you're going to be auditing each of your packing and shipping processes once a year. And that can include either doing a periodic ongoing qualification test for all your different packouts and locations and temperature profiles, or you have some other options. So you can also do an audit of staff completed packouts, or you can do an audit on packout weights for consistency. So those are some examples that URAC gives for how you're going to monitor your distribution process on an ongoing basis, which is a little bit new. And just remember that as you're doing that, you want to make sure to test every single pack out that you have, every temperature profile, and every area where you're shipping it.
And the word periodic, URAC uses the word periodic because I'm mindful that historically when URAC uses periodic, the applicants cannot use periodic. They need to specify a specific time. Does this look like that's the case for this standard as well? And while you're looking, I'll just give the background on that. URAC will use words like periodic to require you to do certain things, and this has been true for a lot of years. But you, the applicant, have to come up with a time frame that will be your version of the periodic. Your policy has historically not been able to say periodic.
Right, that's correct. So looking at this specific standard, it does say at least annually. So they've defined somewhat periodic for you. It's got to be at least annual in this case.
Okay. And that's certainly our default advice. When URAC says periodic, it should be at least annual as a general rule. There are exceptions to that, but at least annual as a general rule. Great. Thanks for that.
Yeah.